Now, for more on COVID vaccine efforts, let's bring in Dr. George Benjamin. He's the Executive Director of the American Public Health Association. Welcome back to the show.
Thank you. Thanks for having me.
So as we know, a lot of guidelines changing every day with masks and restrictions. How are businesses and workers dealing with all these relaxed rules?
You know, we were really challenged in getting some of those rules in place in the first place, and it got pretty messy. And I think it's going to be pretty messy as we try to reopen our society. But we're learning. People are learning to adapt. We're a pretty resilient, community. But I think that the fact that we no longer have to wear masks if you're fully vaccinated in the United States is a good thing.
Now, as you mentioned, it took a while for most people to get physically and mentally comfortable wearing them, and it obviously became a political issue in many countries. So now, after a year, mask guidelines being switched, what about consumer reaction? Will people still wear the masks even if they are vaccinated?
You know, what's been interesting is, the United States has not been a mask-wearing culture, although many of our colleagues in Asia have been for many years, particularly after the first SARS outbreak. But I think that many of us will be wearing masks, particularly even during flu season. So I think we're going to be becoming a culture that sees many, many more people wearing masks during cold and flu season, and certainly if COVID continues to, be prevalent in our communities.
Now, moving to the younger demographic, we know that vaccinations for 12 to 18-year-olds are underway, but what about even younger children? What's the timeline for getting their shots?
Well, we think that those younger children will be eligible. This is under the age of 12, probably, end of the year, maybe the beginning of next year. But it's not, I don't think, on our future for this coming fall when kids return to school.
So then how do you think some of these new mask rules will apply to children and their households, sort of different camps and things?
Well, the good news is that we really want to get everyone fully vaccinated. And for those people who are fully vaccinated, you're safe and you don't have to worry about wearing the mask if you choose not to. And that in the United States, that includes children 12 years of age and older. The younger children, the good news is they don't seem to get as sick and they don't seem to be as infectious. And so in many of the situations, they will be wearing a mask, particularly in some of the school settings. But we're going to have that no matter what happened this year.
And to your point, I mean, we did see also a milder cold and flu season this year. Obviously, a lot of people not spreading germs as much. How do you think that affects opinions about masks?
I think if we message it right and people understand that it not only protected us from getting COVID, but it also protected us from getting influenza when partnered with good hand washing, some social distancing, and getting vaccinated. But as you know, always vaccination is still the key.
And obviously looking ahead, we've got summer vacation season coming up. What will navigating all the different countries' requirements on things like masks and vaccine passports look like?
We're beginning to see nations opening up for the fully vaccinated individuals. And then we're going to have to work our way through this issue of vaccine certifications that many of the nations are looking at. And I think that hopefully we can get some harmonization around that around the world in the next couple months. But right now, that's also pretty messy about documenting whether you're vaccinated or not.
And obviously the summer tourist season, a goldmine for travel-related companies, especially after this year of restrictions and lockdowns. Do we know what the expectations are for some of these major tourism hubs as they reopen?
Well, I think people are going to be much more thoughtful. You'll be able to get tested if you need to, if you have symptoms. But again, I think the solution for all of this is for everyone to get fully vaccinated. And there's very, very few people that cannot get fully vaccinated. Now, we all understand that some of the low and middle income countries, we have not been successful in even getting them started to get vaccinated. And so we have a lot of work to do to make sure that they're safe as we are.
And we know that that's especially the case as we take a look at what's happening with India and Brazil. What's the latest on their efforts to contain the virus and get treatments?
India, as you saw in your preview segment, is really going through some challenges. They are beginning to see some tapering off of the outbreak. But as you know, the disease prevalence is about 2 to 3 weeks later. So they may still see a fair number of cases. And tragically, they're going to have many, many more deaths before this is over.
So then what are global vaccination rates looking like, and how evenly spread are they among some of these wealthier versus poorer nations?
The vaccination rates are terribly uneven. And even amongst the more prosperous Western nations and the European nations, we're still having a lot of unevenness in vaccinations, although they are picking up. But I think the big hole remains the lower and middle income countries, many of whom have not even begun to vaccinate their populations.
And as the WHO said, if we're not all vaccinated, then we're all at risk. Thank you so much, Dr. George Benjamin, there, Executive Director of the American Public Health Association. Thank you so much.